Myself, Dr. Nishad SK, Senior Consultant in Internal Medicine and Diabetes. In today's video, we will explore how safely and effectively we can reduce the insulin requirement of people with type 2 diabetes. Whether you are a newly detected diabetes or you're a diabetic for many years, say for 2 to 3 decades, you are on insulin, we will explore how we can reduce the dosage of insulin. This video is backed by science as well as my 15 years of clinical experience in managing diabetes as well as the strategies in reducing medications, especially the insulin and many oral hypoglycemic agents. Type 2 diabetes is not an insulin deficient condition. Predominantly, majority of the patients what we see have insulin resistance as the trouble. So, insulin resistance is the reason for type 2 diabetes, where insulin is unable to act. Insulin is not working. In that situation, we are giving insulin exogenously, that's from outside, and we are trying to bring down the glucose values. But lowering glucose value is not the ultimate aim in managing type 2 diabetes. We need to take care of the complications. We should prevent the complications. Also, pathophysiologically, we need to take control of the underlying insulin resistance, or the target should be that we should increase insulin sensitivity. So, improving insulin sensitivity should be the sole aim in managing type 2 diabetes. Until and unless the patient is insulin deficient, we are not justified in giving insulin. But in different situations, insulin is life-saving, especially people who have infections, sepsis, somebody who is undergoing surgery, somebody who is having inflammation, somebody who is on steroids. So all these people require insulin. But when we target to improve insulin sensitivity, then there are various steps which we can take to prevent insulin resistance or which can lead to increase in insulin sensitivity. What are the evidence-based strategies for reducing insulin resistance? First and foremost point is low carbohydrate dietary pattern. That means you're bringing down the percentage of carbohydrate in your diet. Now, we people are tuned to around 85 to 90% of carbohydrate. That means, practically speaking, very small percentage of proteins or fat are included in our diet. I beg to differ. Sometimes we take a considerable amount of fat but not protein. In this situation, we can have high fiber containing carbohydrate or high fiber fruits, vegetables like berries, and also absolutely avoiding highly refined carbohydrate products. This is very important in managing or improving insulin sensitivity. Multiple RCTs have shown that insulin resistance has reduced considerably within few weeks of carbohydrate restriction. The second point which I want to highlight is about time restriction. Time restriction, or popularly called as intermittent fasting, where we have an eating window of say like 8 hours. The remaining 16 hours, absolutely no energy containing food items are ingested. This time restriction helps in reducing hepatic glucose output, thereby helps to improve the fasting glucose level. Also, somebody who is on very high dosage of insulin, this has to be very carefully planned and executed. Third point is daily exercise. At least 5 days a week, one has to exercise 20 to 30 minutes. Strength training is superior to aerobic exercise when it comes to reduction of insulin resistance. But addictive is, if you're doing at least 20 to 30 minutes 5 days a week, then your insulin requirement will also come down by 20 to 30% of the total daily requirement. There are proof, there are data enough to show the improvement in insulin sensitivity when you exercise. Remember, muscle is something like a sponge absorbing water. Likewise, muscle can absorb blood glucose even without the help of insulin. So, activating muscles, activating your muscle fibers by doing exercise, especially larger muscle groups of the muscles of the leg, is well known to reduce the glucose in the blood, thereby insulin requirements comes down. Fourth point is sleep and stress management. Improper sleep, non-refreshing sleep can increase cortisol level. Increase in cortisol level in turn can cause increase in insulin resistance. Managing stress, having a restorative sleep, having an adequate refreshing sleep is very important, as well as managing the stress is very important, because stress and lack of sleep can worsen the blood glucose levels. So you may not be able to reduce the insulin dosage. For that, simple breathing technique, spending 5 minutes in the morning, 5 minutes in the evening, breathing in and out, doing yoga, doing meditation, managing stress. This can work wonderful for you when it comes to lowering the insulin requirement. Weight loss, especially the abdominal fat. If you can reduce your weight by 5 to 10%, sometimes your insulin requirement will vanish. So weight reduction is important, especially reducing your belly fat. Belly fat reduction is not that easy. Even if you achieve, it's very difficult to maintain the way how we all eat. So try to reduce your weight, try to reduce the belly circumference. You will see the difference in insulin requirement. Adding an insulin sensitizers like pyridoxine, metformin, or even SGLT2 inhibitors. These medications help improving the insulin sensitivity, as well as you'll be able to reduce the insulin dosage. When the postprandial blood glucose levels are controlled, you can try reducing prandial insulin. Everybody has to closely monitor the glucose values during tapering. It is also important that you should understand when you are not supposed to reduce the insulin dosage. One is when you are admitted with infection, when you have a florid infection, when you have sepsis, when you're undergoing some surgeries, when you have a foci of infection or inflammation, you are not supposed to reduce the insulin dosage. And so when you are on steroid treatment, the insulin requirement is usually high. Not all type 2 diabetes can be taken out of insulin. So individualization is a key, as well as sometimes it's not possible for everyone to be out of insulin. That has to be always kept in mind. Reversing insulin resistance is actually possible, because doing it in a monitored, structured way under the guidance of a doctor will help you. Not just switching over from one medicine to one medicine, not just following the adequate lifestyle strategies, but a structured view or a structured approach can definitely help each and everyone who is suffering from type 2 diabetes and on insulin to get out of insulin, or at least taper the dose of insulin by following simple lifestyle modifications. So when you reduce the dosage of insulin, we have to do it safely, scientifically, and with proper guidance. If you like this video, please support us, share it with friends, and share it with somebody who is struggling with type 2 diabetes. Let's break the myth that diabetes only worsens. It doesn't have to. Thank you very much. Jai Hind.